In this presentation, we'll be discussing data quality and ethics. Healthcare leaders face many challenges today, including payment reform, changes to standards and classification systems, health information exchange, and value-based purchasing programs. The common thread in these challenges is ensuring that data are a trusted source and that can be easily accessed, shared, and exchanged. As electronic health record systems have become more widely implemented in all healthcare settings, the need for information governance is greater than ever. To meet these advanced challenges, rigorous information and data governance stewardship, management, and measurement is fundamental. As a result, AHIMA, created a data quality model to illustrate the different data quality challenges that healthcare professionals face. This model is generic and adaptable to any care setting and for any application. The tool expands beyond the EHR to include data quality across the healthcare continuum. It is a tool or a model for all healthcare professionals to assist in the transition to enterprise-wide data quality model roles. The tool can be applied to all data in the organization and expands to encompass both clinical and non-clinical areas. Healthcare data quality practices are evolving from paper records to department-based systems and to large enterprise systems. These practices now utilize electronic searches, comparative and shared databases, data repositories, and continuous quality improvement. HIM professionals are experts in collecting and classifying data to support a variety of needs such as severity of illness, meaningful use, pay for performance, data registries, and data mapping. Further, HIM professionals encourage and foster the use of data by ensuring its timely availability, coordinating its collection, and analyzing and reporting collected data. To support these efforts, the proposed data quality model provides 4 domains and outlines the basic tenets for data quality management, including the application, collection, warehousing, and analysis of data. As a result, the data quality model includes characteristics for describing data accuracy, accessibility, comprehensiveness, consistency, currency, definition, granularity, precision, relevancy, and timeliness. We will look at further examples of each of these areas. Many HIM professionals are expanding their responsibilities to include information governance, data governance, and stewardship. Leadership, management skills, and information technology knowledge are all required for expansion into these areas. Roles such as clinical data manager, terminology asset manager, and health data analyst positions will continue to evolve into opportunities for those ready to upgrade their expertise to keep pace with changing practice. In close alignment with the data quality model is the AHIMA Information Governance Principles for Healthcare, which provides the foundation of data and information governance through 8 key principles, including accountability, which designations or identifications of a senior member of leadership is responsible for the development and oversight of the information governance program. Transparency, defined as documentation of processes and activities related to IG, are visible and readily available for review by stakeholders. Integrity, systems evidence trustworthiness in the authentication, timeliness, accuracy, and completion of information. Protection, program protects private and confidential information from loss, breach, and corruption. Compliance, program ensures compliance with local, state, and federal regulations, accrediting agency standards and healthcare organization policies and procedures, and ethical practices. Availability, structure and accessibility of data allows for timely and efficient retrieval by authorized personnel. Retention, lifespan of information is defined and regulated by a schedule in compliance with legal requirements and ethical considerations. Disposition, the process ensures that legal and ethical disposition of information, including but not limited to record destruction and transfer. Data accuracy is defined as the extent to which the data are free of identifiable errors. To facilitate accuracy, determine the application's purpose, the question to be answered, or the aim for collecting the data element. Standard acceptable values should be used where available. Where possible, value flags such as dosages, drug interactions, allergies, and constraints should be implemented. Use of structured data is important to enable the shared and exchange of health information with HIEs and other organizations. The system of data entry for lab values, such as temperature or blood pressure, must maintain a consistent integer format. Any deviation to free text, for example, might cause the loss of misinterpretation of data. Ensuring accuracy involves appropriate education and training, along with timely and appropriate communication of data definitions to those who collect it. Data definitions require continuous revisions and validations to stay current. The application should constrain entry to allow values where possible. For example, data accuracy will help ensure that a patient height cannot be entered erroneously as 5 inches when it is in fact 50 inches. In addition to a primary data error, this would impact any calculated fields such as body mass index. To warehouse data, appropriate edits should be in place to ensure accuracy, such as basic field length checks. Also, error reports are generated related to transfers to and from the warehouse. All warehouses should have a correction and change management policy to track any changes. To accurately analyze data, ensure that the data architecture, relationships, algorithms, formulas, programming, and translation systems are correct. For example, ensure that the encoder assigns correct codes and that the appropriate diagnosis-related group, DRG, is assigned for the codes entered. Continual data validation is important to ensure that each record or entry within the database is correct. Construct validity occurs when the theoretical construct of cause and effect accurately represent the real-world situations that are intended to model. This is related to how well the experiment is operationalized. A good experiment turns the theory or the construct into actual things you can measure. Sometimes just finding out more about the construct, which itself must be valid, can be helpful. Construct validity is thus an assessment of the quality of an instrument or experimental design. It doesn't measure the construct it's supposed to measure. If you do not have a construct validity, you will likely draw incorrect conclusions from the experiment. Convergent validity occurs where measures of constructs that are expected to correlate do so. This is similar to concurrent validity, which looks for correlation with other tests. Discriminant validity occurs where constructs that are expected not to relate do not, such that it is possible to discriminate between these constructs. Convergent and discrimination are often demonstrated by correlation of the measures used within constructs. Convergent validity and discriminant validity together demonstrate construct validity. Internal validity occurs when it can be concluded that there is a causal relationship between variables being studied. A danger is that changes might be caused by other factors. It is related to the design of the experiment, such as in the use of random assignment. Conclusion validity occurs when you can conclude that there is a relationship of some kind between two variables being examined. This may be positive or a negative correlation. External validity occurs when the causal relationship discovered can be generalized to other examples, time, and contexts. Correct sampling will allow generalization and hence give external validity. This examines the ability of the measure to predict a variable that is designated as a criterion. A criterion may be externally defined. It may be a gold standard. Achieving this level of validity thus makes results more credible. Criterion validity, related validity, is related to external validity. This measures the extent to which a future level of a variable can be predicted from a current measurement. This includes correlation with measurements made with different instruments. For example, a political poll intends to measure future polling intent. College entry tests should have a high predictive validity with regard to final exam results. This measures the relationship between measures made with an existing test. The existing test is thus the criterion. For example, a measure of creativity should correlate with existing measures of creativity. Face validity occurs where something appears to be valid. This, of course, depends very much on the judgment of the observer. In any case, it is never sufficient and requires more solid validity to enable acceptable conclusions to be drawn. Measures often start out with face validity as the researcher selects which seem likely to prove the point. Validity as concluded is not always accepted by others, and perhaps rightly so. Typical reasons why it may not be accepted include inappropriate selection of constructs or measures, insufficient data collected to make valid conclusions, measurements done in too few contexts, measurements done with too few measurement variables, too great a variation in data where it can't you can't see the wood for the trees, inadequate selection of target subjects, complex interactions across constructs, subjects giving biased answers or trying to guess what they should say, experimental method not valid, or operation of experiment is not vigorous. Assessing data accuracy can be done most easily through face validity by checking some simple measurements. First, check if the data type is correct. Does it take on numeric format when it should be text? Is the range of values appropriate? Are there negative values present when they shouldn't be? What do blank entries mean? Are there enough digits in a field to have a valid entry? Are the values real? Does the listed values align with known standards, such as with diagnosis codes? Do the totals make sense? These are just a few ways simple descriptive summaries can aid in assessing data accuracy. Data accessibility is defined as data items that are easily obtainable and legal to access with strong protections and controls built into the process. The application in legal, financial process, and other boundaries determine which data to collect. Ensure that collected data are legal to collect for the application and are based on well-defined privacy and content standards. For example, recording the date of birth and race in an EHR is appropriate and should only occur once with verification. Subsequently, the value should roll forward. When developing the data collection instrument, explore methods to access needed data and ensure that the best, least costly method is selected. The amount of accessibility may be increased through system interfaces and integration of systems. For example, the best and easiest method to obtain demographic information may be to obtain it from an existing system. Another method may be to assign data collection by the expertise of each team member. For example, the admission staff collects demographic data, the nursing staff collects symptoms, and the HIM staff assigns codes. Data entry should undergo a cost-benefit analysis process to determine which method provides the best data most efficiently. Technology and hardware impact accessibility. Establish data ownership and guidelines for who may access or modify data and/or systems. Inventory data to facilitate access. In the EHR, it may be advisable to establish data ownership or governance at the data element level, especially data which are reused. For example, allergies are recorded by many different clinicians and come in many forms. Who defines what an allergy is? How does this impact the use of allergies in the EHR, especially for clinical decision support? Access to complete current data will better ensure accurate analysis and data mining. Otherwise, results and conclusions may be inaccurate or inappropriate. For example, use of the Medicare Case Mix Index alone does not accurately reflect total hospital case mix index. Consequently, strategic planning based solely on case mix index may not be appropriate. To assess data accessibility, determine who has access to the data and who should have access. You may need to remove users or add users. The best approach is to consider balancing transparency and accountability with privacy. Data comprehensiveness is defined as all required data elements are included. It ensures that the entire scope of the data is collected with intentional limitations documented. You have to clarify how the data will be used and identify end users to ensure complete data are collected for the application. Include a problem statement and cost-benefit or impact study when collected data are increased. For example, in addition to outcome, it may be important to gather data that impacts outcomes. Cost-effective comprehensive data collection may be achievable via interface to or download from other automated systems. Data definitions and data precision impacts comprehensive data collections. Warehousing includes managing relationships of data owners, data collectors, and data end users to ensure that all are aware of the available data in the inventory and accessible systems. This also helps to reduce redundant data collection. You also must ensure that all pertinent data impacting the application are analyzed in concert. This is especially important when EHR clinical decision support is utilized. Incomplete data can result in underreporting a numerator or denominator. Assessing data comprehensiveness is often carried out by determining if the fields are complete or if there is enough information to make sense of the data. If the data doesn't tell a complete story, information may be missing. Frequent audits of a sample of data can assist in determining if there are challenges with data comprehensiveness. Data consistency is the extent to which the healthcare data are reliable and the same across application. Data consistency adds to the integrity of data. Data are consistent when the value of the data is the same across applications and systems, such as the patient's medical record number. In addition, related data items should agree. For example, drug dosing. The use of data definitions, extensive training, standardized data collection, and integrated interfaced systems facilitate consistency. Static data should be moved between users. For example, one date of birth has been definitively established. Age at the time of treatments should be calculated, not entered by a user who might make an error. Warehousing employs edits or conversion tables to ensure consistency. Coordinate edits and tables with data definition changes or data definition differences across systems, and document edits to the data relationships and linkages. Analyze data under reproducible circumstances by using standard formulas, scientific equations, programming, variance calculations, and other methods, and compare apples to apples. Any manipulation of data, aggregated or otherwise, should be documented thoroughly to identify data sources, types, codes, and calculations. For example, how is BMI calculated, and has the formula been checked? To assess data consistency, consider how much variation there is in a non-structured field. Take, for example, the use of abbreviations. Is there a consensus on the abbreviations that are used? Determine if there are standards employed, and if so, determine if all users understand the standards and how to use them. A common measure is to look at data against itself, or if the data is duplicated in a slightly different format elsewhere, and try to confirm the presence of the information. Data currency is the extent to which data are up to date. A datum value is up to date if it is current for a specific point in time. It is outdated if it was current at a preceding time, yet incorrect at a later time. The appropriateness of the parameters or values within an application changes over time. Currency preservation is essential. Within an EHR, it is imperative that guidelines and algorithms are consistent and up to date. For example, acceptable blood pressure ranges have lowered, as have target hemoglobin A1C levels. Data definition changes are modified over time. These should be documented so that current and future users know what the data mean. These changes should be made in accordance with information and data governance policies and practices. Further, they must be communicated in a timely manner to those collecting data and to the end user. To ensure current data are available, warehousing involves continually validating systems, tables, and databases. The dates of warehousing events should be documented, as well as challenges with memory and storage limitations. The lack of availability of current data impacts the data quality. Clinically, issues such as lack of patients' most current lab values, medications, or a new diagnosis can impact another application, which may be abstracting such data necessary in tracking disease outbreak or for biosurveillance purposes. Validating data from various fiscal and calendar years should also be considered. Data currency is determined by determining if the most up-to-date standards are used to store or code the data. Often the system specifications are evaluated and values are updated accordingly. Data definition is the specific meaning of a healthcare-related data element. The application's purpose, the question to be answered, or the aim for collecting the data element must be clarified to ensure appropriate and complete data definitions. For example, the distinction between ethnicity and race should be understood and consistently applied during the registration process. Selection options for these fields should be limited to choices that are in adherence with the data dictionary. Clear, concise, and consistent data definitions facilitate accurate data collection. Inconsistent data definitions are problematic and affect patient care, such as not being able to correctly identify a patient. A data dictionary provides a descriptive list of names, definitions, and attributes of data elements to be captured in an information system or database, and offers a base for data not to be misinterpreted. Warehousing includes archiving documentation and data. Consequently, data ownership, documentation, and definition should be maintained over time and clearly communicated to staff. Inventory maintenance activities such as purging, updates, and others. The purpose for collecting the data, collection policies, information management policies, and data sources should be maintained over time also. For appropriate analysis, displayed data needs to reflect the purpose for which the data were collected. Appropriate comparisons, relationships, and linkages need to be shown visually. Data definitions are assessed by experts to determine if the data dictionary offers a precise meaning or significance. Any incorrect data elements are then corrected. A fast check may look if data limits are exceeded. Data granularity is the level of detail at which the attributes and values of healthcare data are defined. A single application may require varying levels of data or granularity. For example, consensus statistics may be utilized daily, weekly, or monthly, depending upon the application. Census is needed daily to ensure adequate staffing in food services. However, the monthly trend is needed for long-range planning. Similarly, lab test results may be trended at various levels of detail. Collect data at the appropriate level of detail or granularity. For example, the temperature of 100 degrees may be recorded. The granularity for recording outdoor temperatures is different from recording patient temperatures. If patient Jane Doe's temperature is 100, does that mean 99.6 degrees or 100.4 degrees? Appropriate granularity for this application dictates that the data need to be recorded to the first decimal point, while appropriate granularity for recording outdoor temperature may not require it. Warehouse data at the appropriate level of detail or granularity. For example, exception or error reports reflect granularity based on the application. A spike or exception in daily consensus may show little or no impact on the month-to-month data or monthly reports. Appropriate analysis reflects the level of data or granularity of the data collected. For example, a spike or exception in the daily consensus resulting in immediate action to ensure adequate food service and staffing may have had an impact on an analysis of the consensus for long-term planning. Of particular note for the analysis is the impact of any rounding which might be done for numerical data. Data needs to be collected at the appropriate level of specificity. In assessing data granularity, one can determine if the intended metrics specify enough to support conclusions, or determine if a change in the data or artifact is signaling a significant event. Data precision is the idea that data values should be strictly stated to support the purpose. The application's purpose, the question to be answered, or the aim for collecting the data element must be clarified to ensure data precision. What level of detail is needed for the data collection purpose? Are age ranges or 4 U.S. regions sufficient? To collect data precise enough for the application, define acceptable values or value ranges for each data element. For example, limit values for gender to male, female, and unknown, or collect information by age ranges, or allow more detailed collection to fully meet the needs. Are warehouses receiving and storing all data elements being transferred from the source system? If the precision of the data has been altered in the analysis, is the process understood and well documented? For example, analyzing a blood pressure value before and after the initiation of antihypertensive medication will not be precise unless the purpose is clearly stated and data values are clearly defined as the before antihypertensive and after antihypertensive blood pressure values. Reliability is a measure of how close and consistent values are to one another. Data can be reliable where there is consistency, but not value, shown on the left. Or data can be valid where the target is hit periodically, but with no real consistency, which is shown in the center. However, when data is valid and reliable, it is considered accurate. Data precision is really looking to see how consistent the values are. Data relevancy is the extent to which healthcare-related data are useful for the purposes for which they were collected. The application's purpose and the rationale for collecting the data element must be clarified to ensure data relevancy. To better ensure relevancy, complete a pilot of the data collection instrument to validate its use. A parallel test may also be appropriate, completing the new or revised instrument and the current process simultaneously. Communicate results to those collecting data and to the end users. Facilitate or negotiate changes as needed across disciplines or users. Establish appropriate retention schedules to ensure availability of relevant data. Relevancy is defined by the application. It may be appropriate for warehouses to subset data related to its relevancy for certain purposes. For appropriate analysis, display data to reflect the purpose for which the data were collected, as defined by the application. Demonstrate appropriate comparisons, relationships, and linkages to establish relevancy. Data must be pertinent to the purpose for which it is collected. For example, if a patient is experiencing chest pain, collecting data such as cardiac lab values, EKG results, etc., are relevant to the care of the patient. To assess data relevance, the best approach is to consult with content experts regarding whether the collected data is most relevant for an assessment. Data timeliness is the concept of data quality that involves whether the data is up to date and available within the useful time frame. Timeliness is determined by how the data are being used and their context. Timeliness is defined by the application. For example, patient consensus is needed daily to provide sufficient day-to-day operations such as nursing and food service. However, annual or monthly patient consensus data are needed for the organization's strategic planning. In the EHR, vitals may be taken once per visit for ambulatory patients, but every 15 minutes or more for more critically ill patients. Timely data collection is a function of the process and collection instrument. In the EHR, system performance plays an important role in data timeliness. Data display should be sub-second and data entry should occur instantaneously. Warehousing ensures that data are available per information management policy and retention schedules. For EHR clinical data warehouses, is the data updated concurrently or does it occur in a batch or process? Timely data analysis allows for initiation of action and to avoid adverse impacts. For some applications such as allergy drug or drug-drug interactions, timely may be seconds. For others, such as the prevalence of a disease over time, it may be years. Data timeliness is assessed based on whether data is representing the time in which it was collected. The way this is done is to determine the difference in the time the data were reported versus the current time. An example is if a person named Tina Jones provides details of an updated emergency contact number on June 1st, which is then entered into the patient database by the receptionist on June 4th. This indicates a delay of 3 days. This delay breaches the timeliness constraint if the service level agreement for changes is 2 days. Electronic health records are increasingly being implemented in many countries. However, technologies can introduce some hazards, hence safety of information in the system is a real challenge. Recent news of scrutiny of security breaches has put a question mark on these systems. Despite its increased usefulness and increased enthusiasm and adoption, not much attention is being paid to the ethical issues that might arise if the wrong data or wrong person accessing the information. Securing an EHR with an encrypted password is a probable option. Also, assessing data quality is paramount to supporting the ethical use of the data. To ensure that the right people are accessing the right information, allow only the authorized individuals to have access to data. Common assessments, such as auditing user logs to find if unwanted users are accessing data, are warranted. Prevent access to certain systems and data by setting user privileges. Ultimately, the user is responsible for the information they view and the use and misuse of that information. Security measures such as firewalls, antivirus software, and intrusion detection software must be included to protect data integrity. Organizations need to specify policies and procedures to maintain patient privacy and confidentiality and create individual accountability. Routine random audits should be conducted on a regular basis to ensure compliance with hospital policies. When implementing a system, engage the user in the process. Assess user acceptance as a measure and listen to users about what they want and don't want. Identify standard best practices for system implementation, and don't forget about workflow. The last thing you want to do is introduce a system that makes everything take longer to complete. Also, maintain an up-to-date system and notify users of any updates. Lastly, ensure that there is an accurate representation of a patient. Improper use of cut and paste functions can create duplicate medical records or unnecessary reporting and information, thereby affecting data quality. When exchanging data, measure completeness. Any loss of data can occur during the transfer and create data quality concerns. In conclusion, data quality can be understood and measured in a variety of ways, and it's important to consider ways of measuring data quality. The idea is to have the best information that is representative of the subject, whether that is a patient, hospital, health program, etc. Finally, ethical handling of data and systems is pertinent to maintain trust and proper use of data.